We are delighted to have with us today a congressman whose ideology strongly aligns with AMAC members. Currently serving his 7th term in Congress, he has voted to cut income taxes, repeal Obamacare, and most recently co-sponsored the Health Act. The representative from Tennessee's 4th Congressional District, Congressman Scott Desjarlais, welcome to the show.
Thank you. Appreciate you having me on.
Well, I want to thank you for being an original co-sponsor of the Health Act, a bill that enables primary care doctors to serve low-income patients and receive a tax deduction for doing so. Now, as a doctor yourself, tell us from your perspective why you think this legislation is important both for doctors and patients.
Okay. Well, I think it's been a problem that we've seen grow over the years and got worse under Obamacare. I started practicing medicine in rural Tennessee in 1993, and we began to see an overutilization of emergency rooms. And actually, the year that I started there, we had a program called TennCare, which was a little different than other states' Medicaid. It was taken on by different providers like Blue Cross. There was a John Deere Healthcare Access Med Plus, and they provided the Medicaid to the state. But the reimbursement continually grew lower in terms of our reimbursement compared to traditional Medicare or private health insurance. And it seemed like it was just more and more difficult to establish doctor-patient relationships. Maybe the system got overutilized a bit, but eventually a lot of people migrated to ERs, whether it was out of convenience, but it just wasn't a very efficient system.
Very interesting. Now, you had mentioned that you had a similar idea to the Health Act long ago. Can you go into maybe a little bit more detail about what your vision was and how you think it aligns with the Health Act?
Well, I mean, it's similar. It was just that, we end up doing a lot of pro bono work as physicians anyway, and that wasn't really a big problem before so many changes occurred to healthcare. But reimbursement continued to go down, and cost, whether it's rent or employees and wages, continue to go up. So, there was a decrease in profitability in the medical practice, and no one really felt sorry for doctors, but it got harder and harder to provide the care as they added more regulations, rules, and changes. So it just seemed to make sense to me that I didn't mind doing pro bono work, but it seems like instead of doing it for free, if you could at least get a tax break and maybe get a reduction in your taxes, then it would help with overall overhead. And so this bill kind of aligns with that. But, the ER overcrowding issue was a lot due to just, triage, because probably 80% of ER visits even today are non-emergent. So it plugs up the system for people who do have true emergencies, whether it be a car accident, a fall, a fracture. This bill kind of combines all those aspects to where physicians could be reimbursed for doing pro bono work, and it would also help establish better relationships with the patients, and they would have a actual doctor rather than whoever happens to be working in the ER.
Well, thank you. We appreciate your support. Now, after becoming a member of Congress, you voted to repeal Obamacare, something our members were very much largely against. Against Obamacare, that is. Can you tell us the severity of the negative impact Obamacare has had on America as a whole, as someone who is both a medical professional and a politician?
Yeah, well, I mean, honestly, it's the people. They always talk about the middle class and protecting the middle class, but the people who are kind of stuck in between, if you're not poor enough to qualify for Medicaid and you can't afford private insurance, it seemed to drive the cost of private insurance up. There were people that were kind of stuck in the middle. So if you didn't work for a company that provided health insurance, you kind of fell into this loophole, which is about 7 or 8% of Americans that maybe made between 50 and 100,000 as a couple. They're having to pay health insurance premiums that could be up to $25,000 a year. And I mean, it was simply unaffordable. So Obamacare inadvertently left out probably some of the hardest working Americans, and and so it changed the way people had to look at their employment. They maybe had to go work at Walmart to get the health insurance, and it was out of their field of expertise. So it ended up hurting a lot of people. Plus, I think it drove down the quality of care. Socialized medicine doesn't work. I remember early on in the 90s, all the doctors from Canada were wanting to come to the United States, and patients were traveling to the United States so they could get health care. You can look at England and other countries where basically you have to stand in line for a hip replacement, or we kind of saw during COVID when they took away elective procedures, people were not dying of COVID, they were dying of heart attacks because they couldn't get in to see their cardiologist or have necessary procedures. So we kind of learned a lesson the hard way then. But, Obamacare just put more government in control of our lives, and it just seems like we're going in the wrong direction. And unfortunately, as you said, I'm now beginning my 7th term in Congress, and I came here a lot because of the Obamacare law. My patients were complaining about government and the situation that we're in. And so I've never been in politics before, but I thought, well, let me try to do something about it. And sadly, 10 years later, I'm not sure that we were moving in the right direction when almost a third of the Congress are professed socialists, at least on the Democratic side of the aisle. You got 100 or so members that are like Bernie Sanders, and they think somehow that's going to work. And it's not only impacting healthcare, but pretty much all aspects of American life.
Exactly. And what we see Biden doing today is attempting really to expand the welfare program with so many proposals that go beyond the realm of sanity. He wants to expand welfare to 2 new classes of citizens, or recipients, I should say. That is, non-citizens and prisoners.
Yeah.
What are your thoughts? I mean,
look no further than the crisis at the southern border right now that Secretary Mayorkas and Biden says isn't a problem. That our borders aren't open, that our borders are secure. It's like don't believe what you're seeing, believe what we're saying. But these folks that are coming across the border illegally are becoming a public charge. Not only do most of them qualify for food stamps, because even though the Democrats will tell you that it's very difficult to get SNAP benefits if you're here illegally, there's 2 exceptions. Actually, there's 11 exceptions, but the 2 I'll point out is 1, if you're 18 or under, which is an awful lot of people coming in, or 2, if you say you're seeking asylum, which is pretty much everybody. So they qualify for SNAP benefits, and then along with that comes all these other benefits, and in a lot of cases, you just mentioned healthcare. So President Biden's pretty generous with money that we don't have. We've got a $33 trillion debt. We're arguing over the debt ceiling, but yet he's, through executive order, basically doing Congress's job, which is the power of the purse, and giving away money we don't have. And it's just causing problems all across the board.
Yeah, it sure is. Our members are quite skeptical, and Americans as a whole are skeptical about the way that COVID was handled and the so-called indisputable science that was constantly changing, regarding masks, vaccines, forced lockdowns. Anthony Fauci and other medical officials spent a lot of time on television moving the goalposts over the last 2 years, and it's really left many people, including our members, wondering if the medical field and government worked together to use COVID to drive their agenda. Now, as a doctor, you have great experience in the medical profession and, again, in politics. What is your take on how COVID was handled?
Well, I mean, it's always hard to have a crystal ball and to know what the right thing to do was. Initially, President Trump wanted to stop any travel from China, which, of course, he was called all kinds of names for doing, which in hindsight, it makes a lot of sense. But as they were developing vaccines through Project Warp Speed, we saw elderly patients dying at an alarming rate of COVID, but they seemed to fit a certain demographic, and they usually had comorbidities and maybe lung problems, maybe heart problems, and they got COVID, and someone succumbed to it. So it seemed like we needed an answer, and you kind of learn as you go. But what they started doing was more about control rather than following the science. When they started saying that young people, military age, should be getting a vaccine, when there was no real science to back that up, and there still isn't, and we now know that there was a lot of complications, whether it's cardiomyopathy or myositis, then we didn't stop and hit pause. They just continued to push forward, and now they're still talking about vaccinating children, where you look at the statistics and it just doesn't back it up. So at some point along the line, the government stopped following the science. I felt like if you were over 60 and you were at high risk, or maybe even over 50, a vaccine made sense at one point, but it should have been your choice. It never should have been mandated. And we're paying the price now. We paid the price in our schools, our education. Our children have fallen behind. We've had people, well, now they're admitting that if you had COVID, that was as good as having 2 vaccines. But at the time they said, oh no, that doesn't protect you. And again, the science was there to say it was. It was coming out of Israel, out of UK and other nations. But in this country, they just ignored it and continued to beat that drum that if you don't do it our way, you're going to be canceled. You're going to be fired from your jobs. Our healthcare workers, our military personnel, all the people that were heroes that were out there helping battle this pandemic were vilified in the end. And now I think they're realizing they're wrong. I'm sure we'll have lawsuits and court cases for years to come. But it is frightening when the government can take over that many aspects of our lives. We knew that the masks don't work. Even as a doctor, I know the mask kind of protect you from splash injuries or blood and whatnot during surgery, but most of the air goes out the sides, and so there was only a certain type of mask that actually worked, but yet we were all forced to wear them. And then they said wear 2 masks, and the science didn't back it up. Now we see Fauci backtracking and lying about several things, and so it's really disappointing. It builds distrust, sows distrust for the government. So if this happens again, who do we believe and who do we listen to?
Yeah. Well, that's why we really appreciate your perspective here. Now, you're very vocal on social media about the Biden administration failures. I'm curious, in your view, what are his chances of winning in 2024, if he's able to even stay in the race?
Yeah, I don't know. I mean, I did say I don't think he'd make it to the starting line, but I guess technically he's announced his candidacy. Certainly he's not competent to be president. I know Dr. Ronnie Jackson just had a letter go out today that I co-signed on cognitive functioning. I proposed a bill that all candidates for president, really House, Senate, and Supreme Court, should be able to pass a basic cognitive functioning test. It's not hard to take, and unfortunately it would almost take a constitutional amendment to require it for a presidential candidate, but we might be able to tie it in through FEC laws where we can't absolutely require it, but I'm sure the media would be happy to attack anyone who didn't do it voluntarily. But there's no way Biden could pass a competency test. Ronnie Jackson was a doctor for Trump and Obama and even Bush, and he knows firsthand the stressors of the job. And you can watch this president on the TV on any given day. He's not up for the task. He has some days better than others, but most days are terrible. And the rest of the world leaders can see the weakness. It's not where we need to be right now, with China threatening to take over Taiwan, with what Putin's doing in Ukraine. I think with a strong leader, we wouldn't have seen a Ukrainian war, and I don't think China would be making the threats that they are. So, I don't think that Biden will make it to the nomination process. I think that there will probably be some other candidate of their choice slid in. Biden was actually kind of chosen. You don't really want to call him a Manchurian candidate, but they felt like he was the only one that could possibly beat Trump out of that field. And, he's not been pulling the strings, in my opinion, from day one. He's still not. I don't think he's competent to do it. So, but it frightens me what happened in the last election with the mail-in ballots and ballot harvesting, that, it's an uphill battle. Republicans have got to find a way to play the game the way the new rules were set.
Yeah. A broad America has never looked weaker. And so we've got to hope, we've got to pray, we've got to continue to get the truth out there. Thank you so much for joining me today, Congressman. It's been an absolute pleasure to have you with us today. Thank you for taking the time to join us. And God bless you. I hope to have you back with us soon.
Thank you. I'd be happy to come back on.